We're good to go, eh? Hello, friends. Thank you for managing to find us. I know we weren't on the program initially. I'm really glad you're still here. It's going to be a good one. This is HR6, getting started with HRIF projects. If you didn't mean to be here, it's too late. You're here and we need you, so you're staying. The doors are locked now. There is simultaneous interpretation for this, so the headsets, if you need them, are in the foyer in front of the plenary room, and then for this room, it would be channel 5 that you'd want to be on. My name's Alex. I'm one of the community resource specialists with the Canadian Alliance. Very lovely to see you all. And before we get started, I just want to begin with a land acknowledgement. We would like to begin by acknowledging that the 2025 National Conference on Ending Homelessness is taking place on unceded Indigenous lands. I myself am a first-generational newcomer to this space, and so it's been really important for me to do my research and understand, the history and the responsibilities that I have here, the privileges that I enjoy being in this place, and really putting in the work of making sure that I'm acting as much in allyship as I possibly can. I also want to mention that Montreal, or Tiohtià:ke, is historically known as a gathering place for many First Nations. Today, it's home to a diverse population of many peoples.
There's no slides. I don't know if they're supposed to be.
Oh, no, not yet.
Okay.
We respect the continued connections with the past, present, and future in our ongoing relationships with Indigenous and other peoples from coast to coast to coast. Okay, just a quick agenda so you know what to expect from our session today. I don't think it'll take a full 15 minutes, but we'll start with just a brief overview of the HRIF project, and then we've got 2 community presentations that will be just a brief overview of what they're working on in their communities. And then Dawn here will be doing a quick intro on using data to inform projects, and then we'll have a panel conversation and time for questions from the audience as well. So if you've got any questions that come up as folks are doing their presentations, feel free to note those down. For the Q&A session, we will have to ask folks to speak into a mic, and I'll run that around the room just to make sure that it's being captured in the transcription and also for interpretation purposes as well. Oh yes, and HRIF stands for the Homelessness Reduction Innovation Fund. It is a 5-year program for pilots that communities apply for to, actually I'll go over that in the next coming slides, but it's a project that we're really, really excited to be heading, and we'll have our contact information and places where you can learn more about that later as well. So we have with us James from Dufferin County, as well as Josh from the John Howard Society of PEI, and then we've also got 2 of our improvement advisors, Dawn and Chantel, and they'll be taking it over after I'm done the really quick intro to the HRIF program. Okay, so what is the, there we go. What is the Homelessness Reduction Innovation Fund? And just for the interest of me not stumbling over my words, I will refer to it as HRIF for the remainder of the session. It provides one-time grants for innovative, data-driven projects that are geared towards creating measurable reductions in homelessness. It's administered by us, the Canadian Alliance, to communities that submit applications, and our team also offers one-on-one guidance and coaching to participant communities. And another important purpose of the project is that we take all the learnings that have been found out by communities throughout the process, and we share those across the country. It is part of the federal government's commitment to the Reaching Home Canada's Homelessness Strategy as announced in Budget 2024. If there are folks who stayed from the last session where you got a much more detailed breakdown of HRIF, I promise you we're not going to be going as in depth again, so just hang in there. Just wanted to share some eligibility as well in case you had not heard about HRIF and are interested in learning more or having this conversation in your communities. So the first step would be an expression of interest that you would submit, and then we would use that to assess project suitability and eligibility for HRIF. And then folks would be invited to submit an application after that. In order to be eligible for the HRIF funding, communities have to be either the community entity or the designated community under Reaching Home. And you would you could be under the Indigenous homelessness stream, the territorial homelessness stream, or the community lead organization under Built for Zero Canada. Okay. We are currently in round 2 of 5 for the grant, so would love to support any additional communities that haven't submitted expressions of interest yet. We'll pop up our contact information on the last slide, so if you've got any questions, you want to learn more, there's anything that you need to ask us to assess whether that's something that you're interested in, please feel free to jot that down when that's up on the screen, and we'd be happy to walk you through it. Okay, so the purpose of these projects is to find communities that have ideas that they're hoping to use to prove reductions in homelessness, either by increasing move-ins or decreasing inflow into homelessness for whatever target population that you choose that's eligible. And those communities are also required to have quality by name data for those target populations, and that's something that the Canadian Alliance would work with you together on to confirm. And then, as I mentioned earlier, another key part of the work is that the Canadian Alliance also wants to make sure that any successes and learnings and best practices, anything that communities are discovering along the way, those things are being captured and shared with other communities across Canada so that we can all learn from one another and try to implement things that folks have been trying. Okay, so really quick, these are a couple of the things that we're looking for. If you're thinking about what to submit for an HRIF project, SMART goals, I'm assuming most of us have heard of this term before, but specific, measurable, actionable, realistic, and time-bound goals. Of course, it's got to be related to reducing homelessness for your target population. And your aims should also be based on community-level data. And be able to demonstrate a clear rationale for why you need this and what needs to happen to get you there. Dawn later is actually going to provide a short demonstration of how communities are using data, quantifiable data, to inform their project aims. Okay. Yeah, so just to summarize, we want HRIF projects to really shake up the status quo. The funding is not meant for kind of business as usual program funding. It's meant to be pilots. It's meant to help you try something that hasn't been tried before in your community. And so that's where the innovation piece comes in. It doesn't have to be, something that nobody's ever thought of, but if it's something that your community hasn't tried out before, if you're seeing in other communities or other countries where something is really cool that you think would be a good idea to implement in your community, we want to hear those ideas as well. And we also want to make sure that we are considering community context and building projects to the context and the needs of your specific community, of course. Great. I just wanted to put together a few examples for you of, these are made-up scenarios. These aren't real communities just yet because we haven't officially released those. But when we have everything ready and good to go and it's publicly announced, you will be able to track in real time existing community projects on our HRIF website and be able to follow along with progress that way. But just for now, I wanted to give a couple examples of what a project might look like in case, again, your community is interested in discussing this together. So here's one example. It could be a rapid rehousing project. The activities could include landlord engagement, flex funding, targeted case management, maybe focusing on housing folks in non-traditional housing options. So for example, co-ops, maybe family reunification, maybe intergenerational shared rentals. And the aim of this fictitious project might be to increase monthly move-ins into housing for households that are newly experiencing homelessness, so maybe less than 5 months of homelessness. Maybe the aim is by 30%, and the way that they would do that is in order to decrease all homelessness by 10%. So it's kind of formulaic how the aim statement looks, but when you get to that point in time, the improvement advisor would be able to work with you to figure that out. And then we'd, of course, also want to hear from communities what it is that makes their project innovative. So in this scenario, for example, maybe the direct landlord engagement is the piece that hasn't been tried in this community before. Perhaps the alternative housing options weren't available for folks before, so that might be something that's innovative for this project or this community in particular. And maybe streamlining assessment and triage is something that they hadn't set up before, so really leaning into that coordinated access component. I do have a couple more examples that I will leave in the slides that will be available for folks after, so I won't verbally go over these right now. And, I just wanted to point out that there is one more session coming up tomorrow. If you are interested in learning a bit more about how data is used for HRIF. The one on the left was a session that happened in this room just prior, so obviously you can't go back in time and get to that one, but the recording will be available on the app and on the website as well later. But that one is for tomorrow, and they focus really heavily on, again, how they're going to be using data to help inform these projects. So if you're interested in that aspect of it, feel free to check that one out tomorrow. Okay, over to James.
Thanks, Alex. So my name is James Cassidy. I'm the Program Manager for Ontario Works for Community Services in Dufferin. I also have the portfolio of lead for our coordinated access and the Reaching Home community entity. So a little bit about our project. So our project is looking at preventing aging into chronic homelessness and addressing social detriments. Our current housing allowance program is meant for those who are already experiencing chronic homelessness. So another part of that project is looking at those targets for individuals who may not qualify for our current subsidies. And our supports are targeted housing allowances 6 months, up to 6 months, with additional existing funding if required, and some clinical case management supports. Our aim and anticipated outcomes is to reduce the number of people aging into chronicity by remaining at or below our previous 6-month average for 2 months, or at least 9 out of the 12 months since we started the project, and to project completion. Contribute to our community's goal to reduce all homelessness by 30%, and create a stability for individuals who focus on health and building connections, accessing services, and developing life skills. We're looking at cost analysis of approach and can inform any advocacy efforts for maintaining this program once the pilot's been completed. A little bit about our project. So we were able to identify Dufferin County, just for background, is a small county in Ontario, about 70,000 people. So we've been able to identify approximately 19 clients who've aged into chronicity during our 24-25 fiscal year. This group represents nearly half of our current by name list, which is significant for such a small community. Our strategic focus is the goal is to intervene early to prevent chronic homelessness, and our rationale is to extended periods of homelessness, increased trauma, isolation, and social disconnection. So we're trying to get ahead of that before that happens. And our outcome objective is early support can improve those chances of securing housing and achieving some self-sufficiency. That's a brief overview of everything, but I think we're going to cover a little more in the panel questions. Okay. Thanks.
Yeah. Thanks, Jane.
Thank you.
Got my steps in.
All right. Thanks, everybody, for coming to our session and giving a chance to listen to us. I know we're late in the day, so we'll try to inject some energy and keep everybody excited. So as Alex mentioned, my name is Josh. I'm here from John Howard Society of PEI. And my role is centered around kind of a number of different things, but primarily coordinated access, HIFIS, pick count, all of the many things that are associated with some of the stuff that you all probably do. Let's see. There we go. Okay, so our project is a youth wraparound housing program. So for some folks, that might not sound innovative, and it might not be in other communities, but in PEI, there is, or wasn't, I should say, a designated homelessness program for youth. So there was a lot of different organizations doing some fabulous work with youth, but nobody was taking the reins when it came to housing and homelessness. And so everybody was kind of doing that part and parcel as part of the work that they were already doing. And so we looked at trying to take the lead on that. So leading up, we had 0 successful housing placements for youth, again, mostly related to the fact that nobody was prioritizing that. And our project includes a number of different things like case management, life skills training, housing search, landlord partnerships, and some of the other things you can read up here. Our goal is to house 11 youth, which for us represents individuals between 16 and 24. And that's out of the 27 that we had in our community. For those that don't know, PEI is quite small, so those numbers are going to look a little different than they would in other communities, I'm sure. And one of the key focuses of our project is to establish a network of private landlords. We have some good partnerships with the provincial government, but we don't have enough connections with private landlords, particularly when it comes to youth who we all know are harder and trickier to house because of some of the challenges that they come with. So that was one of the key parts of our project. And the other piece that plays into this was this idea of acting as an entry or re-entry point for clients in child protective services or child and family services. So one of the things we noticed when we chatted with their organization before the project is there are a number of people who age out of care and have an opportunity to access resources, but have no interest in being connected to CPS because they've had some historical challenges. So one of the things that we hope to do and have started to figure out how to do is to connect youth to the resources and services that already exist for them through extended services without having them to feel like they are under the umbrella or kind of control of child and family services. And so we can do that as a nonprofit where they can maintain more of their autonomy and choice. Trying to create new pathways. There are no youth shelters, so we're looking at ways to kind of help individuals experience homelessness get into different types of housing or different models of housing. And we've spent the, first 2 or 3 months here, it would be, I guess, 2 months really, going around delivering presentations to different sectors to try to make them aware and try to see about how can we get on board together and work together on this. So very excited to chat a little more about this, but that'll work for now.
Great. Oh, I didn't check if the internet's working. These caps are so small. I'll just intro the slide first. There's also notes.
Okay. Hi, everyone. Thanks for coming. I'm going to spend a couple of minutes just showing you what we mean when we say community level data. So you kind of heard Alex mention it. You heard both projects mention their data points and their percentages, whether it's aged in, what does that mean, move in, some of that kind of information. So I'm going to take you through what that looks like. And some of you, I'm going to actually, so this is fake data from a fake community called Mapleville that we made up just so we could display data and not have to, use real communities' data. I'm actually going to go into the live link. Is that open here? Because it's a little easier to see it that way than in snapshots. take a second for it to load. And I'm curious.
While Dawn is bringing that up there, I just wanted, again, to thank Josh and James for sharing their early HRIF stage projects with us. Many projects, of course, didn't get approved until, got approved in summer, but to get off the ground, many projects started October 1st. So there might not be a lot of learning, so it takes a little bit of bravery to come out and say, this is what we're doing and trying, so thank you very much. And I just wanted to point out, too, that I think it's helpful to note that your projects or your aims don't have to be huge population targets. Like you can clearly see with PEI and Dufferin, they're talking about 10, 15, 20 individuals that they want to move and into housing and reduce homelessness by that amount. And that's okay. Small subpopulations are great as long as they're clearly focused. And really, I think when you're thinking about your aims, it's really helpful if you start to think about, if we do this, we expect this reduction to happen. And then you can think about what else you might learn through the pilot. And I just really wanted to focus that they don't have to be wow projects or intentions. Sometimes it's just about a straight focused reduction idea.
I think we're in business. Great timing. Thanks, Chantel. Curious, a quick show of hands. Does this look familiar to anyone in the room? Raise your hand if it does. 2 people, 3. Lisa doesn't count because she works here. So 2 people. Okay, so this is what we mean by community level data. So when a community is either like the community entity, they would submit data to Built for Zero every single month on their inflow and their outflow. And this is what it looks like. So you can see here that we can see how many people aged in each month, and that's one of the projects that Dufferin is doing. We can see how many people are newly identified in your community month over month. We can see the outflow, like how many people move to housing every single month. So this is what we're referring to when we're talking about community level data. So this is what we use to measure a reduction, a change due to your project. So I'm gonna take it another little step further and show you when a community is trying to decide, okay, what data point do we focus on? What reduction do we want to try to make in our system? When I get you to the right page, it's just a little bit slow. So this is a tool that we use to work with the community. If it's a youth program, for example, that's putting in an improvement project, you would work with your CE on the data piece. So let me just show you kind of how we identify if a project makes sense or not in a community. So this chart here is will be available to every single community with an approved project, and the information's pulled directly from that data that I just showed you in Power BI. So up here we would say, so I'm going to actually use the example of aged in, because that's one of the projects that was just presented to you today. So let's say if the community wants to create a project where they want to reduce the aged in, so the number of people who are turning chronic in their homelessness response system on their by name data, we would look at what would happen if, let's say, you wanted to reduce your aged in by 25%. So it's showing here in the bottom left corner where it says the 12-month average quality data. So that represents the number of people. So right now that community, Mapleville, has approximately 50 people aging into their system every single month. So they have 50 people every month on average that are turning chronic. So if we could have gotten them housed before they turned chronic, that would have reduced their chronic inflow. So if they want to reduce chronicity, reduce the aged in by 25%, that means their aim, and you can see that kind of on the right-hand side where it says monthly aim, that means they want to go from that 50 people aging in down to 38. That's their aim. Every single month. So they want to see no more than 38 people aging in versus the 50 they're seeing now in order for that project to be successful. So that means they're going to divert an overall reduction of 151 people from aging in from the 12 months of the project. So that means, if you look down here at the AIM statement, that means Mapleville will reduce chronic total homelessness by 36%, by reducing aged in by 151 people by the project end date. And to achieve that improvement in the data, in this case in aged in, the average target monthly chronic total aged in would be 38, as I mentioned. So that's kind of how we look at a project idea to make sure it makes sense. If I had plugged in this number and it showed that Mapleville will reduce chronic homelessness by 1%, we might want to look at another data point. We might want to say, you know what, aged in is probably not a big contributor to your inflow into chronicity, into chronic homelessness. So we might want to go back and have a look at the data that I just showed you. I'm going to go back to it, and I'm going to have a look at it and say, you know what, maybe you might have, so actually, Mapleville does not have a high return from house. It doesn't seem like they have some months they have. So let's say maybe we wanted to look at reducing return from house. We want to stop evictions. We want to stop that part of inflow. We would do the same thing. We would go back to that graph. And we would change it. So we're going to say, you know what, we're going to do a return from house project. We're going to create a project that's going to stop people from returning from housing. And we're going to reduce our chronic inflow that way. So let's say we wanted to reduce it by, let's say we just said 10%, what that looks like. So right now, the average number of people returning from housing in Mapleville over the 12 months is roughly 11 people. We want to get that down. If you look at our monthly aim, we want to get that down to 10. If we want to reduce by 10%. So it's kind of I did a lower number just to demonstrate to you that you can do that. That means that you're going to be stopping a total of 13 people over the next 12 months from entering your system, from exiting housing. So you kind of see how we can play with the data points to see what would be a really good project and what would have the most impact in your community. And, really creating your project based on what that percentage is going to look like, so you can realistically identify how many staff is it going to take to, redirect 150 people away from your system, for example. So it's just a tool that we use to help when communities submit ideas. We use this tool to help kind of flesh it out a little bit better. And sometimes we'll use this tool and we'll select a data point and it doesn't make sense because the numbers just aren't there for it to make sense. Once the project is up and running, this is something that we're constantly paying attention to, is this first data piece right here. So every single month the data is submitted, we're constantly paying attention to the inflow into your system and the exiting of your system to make sure that your project is on track every single month. And if it isn't, what do we do about it? How do we mitigate? What's the problem? Why is this not working? What do we need to change? Sometimes your project can be working really well, but something happens in another part of your system. So if you're, say, housing people and your goal is to house an extra 5 people a month compared to what you're doing now, and that's working really, really well, but you're not getting a reduction because suddenly your inflow is super high, higher than your average, and we didn't anticipate that. We're going to see that happen every single month to be able to talk about it and mitigate what needs to be mitigated so that you're still seeing reductions in community. Going to stop there. Questions, or we'll do that after? Any questions about this tool?
Maybe put it back on the calculator page.
Or about the data?
Are there questions about any of the terms that we use either? I know there's a bit of jargon as well. Are we doing okay with this so far? Okay, perfect. Thank you.
Good. Thank you.
Thank you.
Oh, yes, go right ahead. I'll stay here to answer. Go ahead.
Do we need the microphone?
Oh, 1 second, we're going to get a microphone for you.
Just for the recording?
Yes, yeah.
Hello.
So part of the issue with the data
Yes.
that I've seen, you've got your project, it's working well, but then there's still a problem because now you're having more people coming into the system
Yeah.
than you had projected.
Yeah.
And I kind of have an idea what the problem is, but now we've already gotten our program going.
Yeah.
What would we do to mitigate that circumstance? Because somewhere they're coming downstream faster than we can manage it.
Right.
So how do you mitigate that in your project?
Yeah. So there's two other graphs here that I didn't get into today because the presentation today is not necessarily about the data. That's what tomorrow will be about. I just wanted to do a little snapshot. But there are a couple of other tools that we'll be using with communities to monitor every single month what's happening. So we'll be able to say, you know, yes, your project's working, you're meeting your targets every month. But are you reducing? Because we all know there's other parts of the things happening in the community besides that one project, right? So if your project is on target and you're meeting your targets, but then there's another graph that shows us if you're actually reducing or not. And if that's showing that you're not reducing chronicity the way we thought this project was going to do, that's when we have to do a lot more. Like we'll be connecting and meeting to dig further into your system to see why. What is it? Usually it's likely to be an inflow problem if you're focusing on housing more people. So your project was still a success. We can show the government this works. This project actually works. Like here's 5 different communities that did a similar project and they were all on target. However, while this is happening over here, we need to be mindful of also what's going on in this part of the system. And to kind of build a case for. You can't just invest in one area and hope for the best in the others. You have to be watching and paying attention to that. Does that help a little bit?
Yes, it does. Because what we're saying, we've gotten an increase of over 300%. We've gotten an increase of over 300% is the projection that we've got in the area that we work in. So while you're housing people, there's so many more people coming into homelessness. And you've got to find a way, whether it's through rent control or something, to stop the inflow.
One of the great things about HRIF as well is there's going to be numerous funding cycles. So if we are seeing trends that weren't planned for, that's not making your reduction target because of inflow or outflow, something that wasn't thought about, we can definitely, like month per month, start looking at that before the next HRIF funding deadline or expression of interest and start working on maybe some planning for that and even fund a way to mitigate it in the future. So, yeah.
Yeah, I'm not sure if it was mentioned, but there's a total of 5 rounds of funding. One's already started. This is where those projects came from. The second round of funding applications are already complete and in review. So round 3, 4, and 5 are still up for grabs, we'll call it. And a community can apply for all 5 rounds with different projects. So that would be a great use of if something like that's happening.
And multiple projects per funding round, too. So we could have some communities that have two HRIF round 2 projects, for example, going on at the same time.
Do we have any other questions related to the tool? There will be, again, a Q&A session after our panel conversation. Good. Okay, I'll hand it over.
All right, question and answer. So Don and I came up with some questions that we thought you might want to hear from our great community representatives here, Josh and James. But, if you have a question or one of our questions as we go trigger you to want to ask something, just raise your hand and we'll get a microphone to you. So
That's the first question.
sure.
Okay. Josh and James. Maybe we'll start off by asking you, what is your role in your community in the homelessness response system, just so folks can kind of have an idea of exactly what you do in community. We'll start with you, Josh.
Sure. Yep, we're all good there. So I did kind of briefly mention, but technically my role is centered around coordinated access. Because PEI is small, we don't have a lot of people within our sort of reaching home or coordinated access data team. So I end up wearing a lot of hats. So HIFIS lead comes into that, pick count lead comes into that. And also do some training. I also help to write some of the applications and expression of interests. And I host a monthly podcast that we do. So.
And I also alluded to it. I'm the program manager for Ontario Works, but I'm also the lead for the community entity for Dufferin County. So with Ontario Works and with the homelessness sector, I really oversee the delivery of the income and person-centered supports, as well as the coordination of our homelessness initiatives in Dufferin County, including funding allocations and some of the strategic partnerships that we develop through our coordinated access.
Thank you. Will I keep going, Chantel? Sure. I'm on a roll. Okay, how did you decide on which data point to focus on as a key focus to make reductions happen locally?
Go ahead.
All right, we'll keep that rotation then. So we used the fun chart that Don showed us earlier there to start to get a visual. And then we tried to pair that with the practical need that we had, which was youth homelessness. Based on the data, it made sense to focus on move-ins and have that be the priority of our project. So that's kind of how we landed on that, and that's what we're up to.
Very similarly, using the data that Built for Zero has been helping us collect, outlining the increase in chronic homelessness in Dufferin County, as well as the feedback that we received through our coordinated access tables, specifically the Reaching Home funded agencies, about the higher level of need and that clients are experiencing, and the caseloads growing. That was primarily the reason why we decided to focus our project on that specific targeted group.
I just wanted to add too, just for the sake of everybody in the audience to understand that both PEI and Dufferin do have quality by name data. And for example, in Dufferin's case, they've had quality by name data for years now, probably since about 2018. And PEI similarly has quality by name data. So the more data you have, the easier it is to build a pilot program.
Are you currently engaging with a sector or agency that you otherwise would not have as a result of this project?
So we were already in some capacity in connection with the Child and Family Services and sort of youth space, but not to the extent that we are now. So as I said, we've taken on the role of trying to be the liaison from a community perspective to try to help people get connected. And we're also working closely with the youth and care team. They have a committee, an aging out of a care committee. And so we've been looking at that too and kind of more integrating ourselves into some of that prevention lens and taking a look at how we might be able to help with that, both maybe potentially this project and then outside of this project. So starting to create some more collaboration in the youth and child and family services space.
Specifically with this HRIF project, there's nothing new as far as partnerships, but what it has done is really increased our and fostered more collaboration and deeper connections with our current service providers. So that's something that we're happy to see that this project's taking on.
Yeah, we asked this question because we just kind of wanted to highlight that we often hear it's hard to get this community partner to the table if we don't have a carrot or we don't have a stick. this funding is a great way to, to start collaboration or to test collaboration with a new community partner together. Because you can access funding to get them to the table. And once you build that relationship, great things can happen, right?
And kind of similar question, but a little different. Who are champions in your local community to get this project off the ground?
So it's hard to kind of pinpoint any one person. There was a number of people that helped make this happen. So just kind of a shout out in general. But what I will say is that when we went around and kind of spitballed the idea of a youth homelessness project with some of the key stakeholders and current organizations, everyone was really supportive and was kind of like, hey, let us know what you need from us. If you need, a letter of support, or if you want to mention that we're on board. So I think we were fortunate to have kind of hit on a priority for a lot of folks, and that really led to them being on board with this.
Similar, because of the size of Dufferin, I would say that our housing stability team was really pivotal in getting this project off the ground, as well as our coordinated access partners, specifically the Reaching Home funded ones, to make sure that our project gained traction as soon as we're ready to go. And also, I'd be remiss if we didn't, acknowledge the Community Advisory Board, who's always, eager to have more resources and supports in the community for homelessness.
Thank you. So we know you're going to be tracking monthly active homelessness during your project, but other than that, are there other data points or monthly data that you want to track for your target population, or to, keep a pulse on to monitor the project in case you need to pivot or make a change?
Yeah, so we have kind of a few things that are interesting to us or that we are interested in. So we want to get direct feedback from the clients and have a sense of what this experience is like and how it's been helpful, or what hasn't been helpful and what we need to do to pivot. We also want to get feedback from the community partners that said they're very bought into this, and see, is it playing out kind of the way that they had hoped. And then in kind of more of a tangible sense, we're looking at things like referrals to get a sense of, okay, people said they were interested in this and this was filling a gap, but are we receiving referrals to indicate that? And are those referrals suitable? And then acuity score. So we use the SPDAT tool to track its acuity over time. And we're also interested in the number of landlord partnerships that we develop. That was one of the reasons that we incorporated a landlord component into our program. So we want to see, does having a designated position focused solely on landlord engagement result in more landlord partnerships? And you can imagine where we would go with that if the answer is yes.
Well, obviously, because we're tracking age-in chronicity, that's definitely a data point that we're tracking. But we're also looking at the outcomes for our sessions and goods and services that are provided by the clinical case managers that are part of this project. We're also looking at the uptake and the impact of our housing subsidies that we're able to provide for clients who wouldn't qualify normally under some of the existing programs we have. And also the service engagement levels and client progress indicators. So, Josh kind of alluded to it with SPDAT, and seeing how people are moving forward within the project timeframes to help us identify where there may be some gaps or how we can adjust our service levels to maximize input.
Awesome. So on that note, are there any tools that you had to create for that? Like for tracking different outcomes other than your inflow-outflow data?
We didn't specifically create any new tools. We're big on using dashboards. We find them to be really helpful because you can kind of get snapshot and you can manipulate the dashboards to display the data that you want and the different categories that you want. So one of the things that we do is at John Howard is every program that we have has its own dashboard. And so we use that as a means of visualizing the data so we can share that with community partners and key stakeholders as the program goes on and be able to kind of see what that looks like, and also have like a month to month, how did that change over time?
Nothing new for tracking. We currently use HRIF as our data kind of system, but we are working with Acre Consulting to make sure that we get the correct reports that we can get in real time so that we can monitor that data, as I said, in real time, making sure that we're able to capture the utilization of the services and any of the client outcomes that come from it.
Perfect. So these projects, both of your projects, are just kind of taking off. Like they're they're weeks old, I want to say, right? So far at this point in the game, what's gone really well for the start of your project? Like what's really flowing so far?
Yeah, so for us, the biggest thing was that it launched on time. As people know, that doesn't always go the way you hope it would. So September 2nd, basically right after the Labor Day weekend, was our launch date, and we had all the staff, started their first day and were there for orientation, and we had already done some proactive work to engage people, so referrals started coming in almost immediately. So that was really great for us. And we have started to get a lot of community support already. Like I said, we've been kind of touring around like a bit of a traveling roadshow, doing presentations, and people have welcomed us and said, hey, come to a staff meeting, come to a committee or presentation. So far, so good in terms of people seem interested, bought in, and we have staff doing what we had hoped they were going to be doing.
Yeah, very similarly with our start date, there's always some challenges, but what really worked, and part of the actual project of itself was just getting it off the ground. The support that we received through our program improvement advisor, so the communication through Canadian Alliance, that really helped us get things flowing. Our team and their enthusiasm to get this project going, to get out of the status quo and have something new initiatives in Dufferin County was very appreciative, and the staff really, acted quickly to mobilize. And then we also had a lot of applicants we had 2 positions, and there was 164 applicants for that. So that really gave us a pool of candidates to choose who were very well qualified for those positions.
Were there any specific challenges that stick out to you so far in the game in the first 2 phases?
Staying in our lane, yeah. So as you started to kind of talk about in your question earlier, it became evident to us when we started getting referrals that it wasn't just homeless youth, it was youth in precarious situations where they needed some support or they were concerned about losing the housing that they had. We have other programs for adults that are 18 plus. So fortunately, a lot of the youth have fallen in that 18 to 24 range so far, and we've been able to try to divert them into some of the adult programs. But they don't have the specialization and the same focus that the youth program does. So that's been kind of something we're navigating in live time is how do we support the youth in the same way that we support the homeless youth, but the youth who are needing more of that prevention or wraparound support piece to stay housed.
Yeah, a couple pieces. So the first one is really, we were excited, we're ready to go, but sometimes having to, pull in the reins a little bit with our own internal processes surrounding, the recruitment process and some delays in that. There's also, stakeholder engagement, being able to, have the stakeholders and our service providers understand and how the project aligned with coordinated access and how it was complementary to the work that's already being done, allowed us to have to, show them that through the data and through the anecdotal evidence that they're providing to us that this was actually a good program, and to get their buy-in to that. Those were kind of the main challenges for us.
Just want to do a quick check-in, Alex, on time. I have 3 more questions. Are we okay to keep going? Okay, great. So I have 3 more questions for you, and one of them is, do you anticipate sustaining this improvement after the project? And if so, do you have any info to share about that?
Fingers crossed would be kind of the way I would frame that. There are a number of people who could be funders that are interested in seeing this program be successful. So early conversations are optimistic and indicate an interest. But as we all know, until there's sort of pen to paper, if you will, nothing's guaranteed. So we don't have anything formalized for when the 12 months ends. But, we're in the end of month 2, so I feel like we have some time to kind of get that sorted out.
Yeah, the program really is in its infancy still. So really we're hoping through the data and the outcomes that we're able to achieve over the 12 months will provide us some advocacy for either different levels of government funding or whether or not this could be something embedded in our coordinated access, maybe through Reaching Home dollars, maybe through other community partnerships. But we're pretty early in the process to determine that yet.
Thank you. And taking into consideration that both projects are kind of in the infancy stages, at this point right now, has this current project kind of unearthed other areas of systems improvement that you're thinking of for other rounds of funding?
Yeah, so I sort of touched on it already. Prevention is clearly a need, which is not necessarily a surprise. We knew that was something that folks are struggling with. I'm sure like other communities, landlord relations can be hard, and when landlords have 10 times the amount of people to choose from that they once did, then they're a little more eager to evict people if things aren't going well or if they could make more money. So that's one of the challenges. But yeah, it has informed us, or maybe the word is reaffirmed us, that prevention remains a priority, which is related to our future rounds of funding that we're looking for. So. Yeah,
very early to see what the data may unravel. We are monitoring our return from housed back into homelessness. That number seems to be creeping up. So that's something that we're already kind of monitoring, and that would be something that we may consider in future rounds, just depending on specifically whether or not that number continues to increase over the project period or by the next HRIF round funding.
Thank you. Last question, and I actually saved this one for last on purpose. It was supposed to be the second question I asked you, so I don't know if you're following in order, and I apologize if I messed you guys up and now putting you on the spot. But really curious to know, like with staff turnover and so much staff burnout, we hear from every community across Canada that this is a problem. And I'm curious, how do you see this project increasing momentum and instilling hope in your teams, in your public community, and in the people that we serve that are going to benefit from this project?
Yeah. So far, what we're seeing is a lot of people coming to us and kind of confirming, like, you hit the target. Like, this is what we needed, particularly the child and care services and the child and family services folks are like, this is what we've been missing for a really long time, which is really positive to hear, both from the project is hopefully going to serve what we intended it to, and when we talk about sustainability. So I think the people that we would be most interested in knowing whether or not it's meeting the needs that we had hoped it was meeting so far are saying, yes, it is. And so for us, that's kind of the best confirmation we can get after, just under 2 months.
I mean, in a time where, homelessness is often, has increased stigmatisms or there's resistance with it, it really allows us as Dufferin to show the community that we're serious about supporting vulnerable populations. And by doing so, showing the community that all of our successes, individual successes, are all about, increased public safety, public health, public wellness, vibrance in our community. So this kind of project will hopefully instill that and shows the community that we're committed to supporting individuals. It also energizes our team. It allows us to kind of break out of the status quo that we've been in with this injection of resources and innovation. So it kind of sparks some new life into a team that does the work day in, day out, but it becomes a little bit monotonous. And this is now a new initiative that kind of regenerates them and our community partners for the services that we're able to now provide.
Fantastic. Thank you so much to both of you. Anything to add, Chantel, or will we pass it over to Alex?
Pass it over.
You're up, Alex.
Okay. That concludes this portion of our presentation. So we do have about 30 minutes for questions from anybody in the audience. We did pop up contact info for James and Josh on the screen there in case you're interested in reaching out at some point. If you've got any questions, any ideas, feel free to take a photo of that. And then I do also have, good, I saw a picture taken. Yeah, okay. I do have one more slide with a couple QR codes. The one in the blue, as you can see, is for the newsletter that the Canadian Alliance puts out. So if you're interested in following along with any existing HRIF projects, we do share there. And then if you want to learn more about HRIF specifically, the one on the left is the one that you'll want to scan. And that'll take you to the dedicated website that we have for the HRIF project if you need to learn more about eligibility. If you want to see when the next round is for expressions of interest, all of that will be there on the website. And then, as I mentioned, the email that we have specifically for this project as well. If you've got any questions, concerns, anything that you need to get in touch with us about, that's the email that you'll want to take down. Okay, any questions from folks? Thank you, because I didn't want us to sit in silence for half an hour.
Is this the right place to ask about partnering with the Indigenous entity as well too? So I guess I would have had the conversation after with one of you, but we're a non-Indigenous organization, non-led, but we do a lot of work through in Calgary with the Stoney Nakoda G4 Tribal Council, and we have a project to partner with them through this. We have it all worked out. We just didn't know the fine details of how to submit it. Because our person was so new there too, Kavita Prasad. I don't know if anybody knows the name there, but that's who we're working with there. But in that thing, I guess my question is, they apply right as the lead, and we're there as support in that area. Is there anything that I should find detail in that partnership that I would need to know that we're not overstepping as the Western entity in that partnership, right? And respecting them as the lead and us as, I guess, kind of the workhorse, just the way it's set up in Calgary, because they're not really, don't do any on the ground work, and we would be doing the actual work with the clients and whatnot?
The Canadian Alliance to End Homelessness is actually partnered with the National Indigenous Homelessness Council, and there are designated people at the National Indigenous Council that are specifically working with communities to develop and revise and manage and monitor their HRIF projects. So I would advise you to connect with them, and yeah, afterwards we can connect and I can get you that information.
Yeah, perfect. I actually connected with Shane.
Yeah.
Yeah, awesome. So
Perfect. Shane would know who to connect you with for sure. Yeah.
Lisa's not allowed to ask questions. She might be responding to that. I was about to ask if she wanted to.
No, I get it.
Oh, okay.
Hi, Nancy Durrani from the Affordable Housing Association of Nova Scotia. Thank you so much for the presentation. My question is about the community projects because, and I don't want to sound like it's not innovative, because it's innovative in that we're measuring and that we're measuring direct impact. But did you have to, in introducing these projects to community, was there any pushback from organizations who may think we're doing that, who may think that they're already meeting that need, especially like housing, preventing chronicity and homelessness, or even wraparound supports for the 18 to 24-year-olds. What was kind of your communication approach to say this is a new project and it's not just an add-on to what you're already doing?
I think you hit the nail right on the head with what you said. Like, that word innovation is meant to spur communities to think about things that they're not already doing, because HRIF is not meant to fund work that already exists or programs or services that already exist in the community. It's meant to fund new, measurable tests of change that might make reductions. Did you want to add to that, Dawn?
Well, I was just gonna, that's 100% correct. Like, we wouldn't fund a project that already exists in community and just add 2 more staff, for example, to expand it or something like that. That wouldn't get approved. But I also just want to say, when we say innovation, we don't mean for you to go out and be insanely creative and come up with this, like, when we say innovation, we mean something that's new in your community. The community next door to you might be already doing it, but if your community is not doing it and it's a gap, then that to us is an innovative project. Sometimes, too, it could be like there's a program that exists in our community that targets this population but isn't yielding results, or could yield better results if they had this particular component to attach to it that might be missing. That could be something too. You can, yeah. Sure.
Yeah, so I'll speak on ours just to kind of add to that. So we kind of did that proactively by, after we had this idea, we spoke to the 2 primary Indigenous organizations in PEI, the province, municipality, and some of the key organizations, and said, like, that were already in the youth space, and basically checked in with them and said, is this different than what you're already doing? And everybody was like, yeah, like, it has components of what we're doing, but like I sort of framed it, everybody was kind of doing it as part of what they were doing, and nobody was clearly the lead. So when we approached it, we said, if somebody was a designated housing-focused case manager for the folks that you're working with in the youth space, would that be beneficial? And everybody was like, yeah.
Did that answer your question at all?
It did. No, I was curious about.
It did. I was more so curious about within a community or a smaller community in Halifax. Like, I'm thinking about it, bringing forward a project and agencies saying, like, what do you mean? We're already doing this, or so it's just sort of that, like Josh outlined, like going to them and saying, so what's the gap? What's the data telling us? Thank you.
Yeah, and we've seen examples, like Josh talks about in community, where somebody's doing this thing, this one caseworker is doing this thing off the side of their desk, but that caseworker gets people housed. So, the innovation part is about, hey, we're going to formalize this test of change and start to measure it. Is it just that, this caseworker is just fabulous, or is it the technique that she's using, or this idea is the solution that can help us reduce homelessness? Yeah.
And you do need to consult with community, with your partner agencies, to see, what the appetite is for your idea, or to ask them to come up with ideas as well.
Okay. Hi. So my question is, I'm from Calgary. So we do have a designated community, I forget the term now. We do have a program that's partly funded by the Reaching Home Grant. but we've had ideas for smaller programs that could bring in some innovation around either homelessness mitigation or helping to sustain some of the people that we work with to make sure that they are able to sustain their tenancy. From what I understand, we can't approach you directly. We can't approach HRIF directly with those programs.
You would need to approach your community, your designated community entity, so, or your Indigenous community entity, and work with them to bring that idea through.
To you. So it would eventually get to you.
Yep.
But we just have to go through.
Yeah.
Okay.
Yeah, so it'd be kind of like a partnership with your CE, your designated community. You would kind of partner, because that's who kind of has the data, so you would kind of partner with them, and they would oversee the application, but both of your names could be on the application. It would come to us.
So are even the indigenous entity ones go to you guys?
Yes. I believe that they're reviewed by the National Indigenous Homelessness Council.
Yeah, we're getting a
Yes.
nod from senior leadership.
Yes, our policy person that knows more about the technical ins and outs is here, so feel free to speak up.
Hi there. I'm from Sault Ste. Marie, Ontario, and I'm the Chief of Paramedic Services there. And I work for part of a broader organization, Social Services, in Sault Ste. Marie. What we're seeing is a lot of overlap between the health needs in our community and the degree of homelessness that's going on and pervades our community. I'm just wondering if you're seeing many community projects that are taking that kind of overlap into consideration in a way is reducing homelessness out in the community, more focused on their health needs or deficiencies.
Well, we know that, health goes hand in hand with homelessness, and we know that health partners need to be at the table to actually, obtain and sustain reductions. So I think your thinking is on the right track. I'm not sure exactly, you might be able to speak to how many projects we've had that have a health-related focus, but definitely with housing retention, we could definitely, see a big need for health involvement there.
Also, too, there may be some overlap, and again, we've with the number of applications that we've received so far, I can't speak to how many may have this component, but it is not uncommon for like a community to, say, for example, to do a prevention idea, which could overlap with, say, discharge from detox or discharge from hospital, for example. So it would definitely require collaboration with health in that way, or if it's housing retention, for example, and we know that they have the data that show that people are losing housing because they don't have the correct mental health or addiction supports, and they need clinical supports. Mm-hmm. So there could be we strongly encourage partnerships like that in the application process, and it's one of the application questions is like, who are you partnering with in community? Who do you need at the table to make this work? Okay. So it'll overlap in that way.
Okay, that answers most of my questions.
Okay.
Under DSAB, we have several different groups, Ontario Works and Childcare, and community paramedicine is part of that as well. And so that's really a lot of the data will be driven by our whole organization and across the different divisions. And is that okay as well, or is that, we collaborate broadly across the community as well and would pull in some of that data for our application. But just saying that we hold a lot of the data under the DSAB organization itself, which is social services.
Yeah. Mm-hmm. Yeah, many communities in Ontario specifically, the service manager is the designated community entity under Reaching Home, or the service manager is the one that holds the by name data. So, you would have the capability and ownership of that data to help create those projects. Yeah.
Thank you.
Any other questions?
So my name is Frederica Walters, and I'm from Durham, the region of Durham. And I just wanted some clarification around something you said. In the application process, we can do more than one grant. And I'm asking that specifically because we worked on a program with our homeless individuals through shelter program. One of the approaches we take is to deal with the trauma. So you have the wraparound service, which everybody talks about. Finding a place once they're ready to go out is the problem. And so that's the next piece that we're looking at. So how would we have two concurrent grants going if we were to apply for something innovative in the next space? Hopefully that made sense.
Yeah, so I think the most important piece is, yes, you can apply for multiple projects in any given funding application frame. But each project needs to be clearly tied to a measurable reduction. So I think we also have to keep in mind that HRIF funding is not meant to fund multi-year projects. It's meant for projects up to 12 months. It's to fund a test of change, not an ongoing program. So when I hear you saying, you know, having health-based recovery type housing, absolutely do we need that? Yeah. Is HRIF able to fund that ongoing? No. Yeah. So
there's a challenge.
So there are the challenges, yeah. And, you know, I'll be upfront and let you know that because HRIF is funded by our federal partners, HICC, we are mandated to follow the Reaching Home funding and expense requirements that they have for all Reaching Home funding. So, you know, that does have some clear parameters as well, such as, you know, limits to ongoing rent supplements and things like that.
Yeah.
So.
Thank you.
Any further questions?
First, super serious question for our panelists. You both said that you wear a lot of hats, so whose hat is the Jay's hat there? Awesome. That's an extra great hat to have, for sure. And a less serious question. For the panelists, what advice would you give to the folks here who are thinking about applying for an HRIF project? What's one piece of advice that you'd pass along?
For me, I think it would be like do the legwork first. So we spent a number of months connecting with other organizations, like I said, and kind of checking in to say, like, is this on point with what the need is? And then we also had like a clear sense of what the roles would look like, job descriptions, all the pieces. So just making sure that you can really hit the ground running, because as we've just kind of had a conversation about, 12 months isn't a long time. So you really want to maximize that 12 months, and you don't want to be spending 1, 2, 3 months getting things up and running when there's a potential to help people during that timeline.
I would echo what Josh says surrounding the piece of, you kind of got to have that in your back pocket ready to go to be able to maximize the time. But I also think that, there's the collaboration piece that you can bring forward in your community. And I also think that, sometimes we think too much about stuff where we just need to kind of do and pick up the pieces as they fall when it happens. And I mean, the worst thing that happens is you're not approved, right? So I think it's just putting yourselves out there and whatever that idea might be, that's impactful to your community.
I do want to add, as somebody who's participated in the review committee, I really appreciate the way the Alliance tries very hard to approve as many projects as possible. We really do have our improvement advisors who work with the communities to make sure it's a solid expression of interest and a solid application. And I don't see that often in granting in the nonprofit sector. It's like usually you get a yes or a no, right? And if you're lucky, they might tell you why it's a no, but we really do work closely with folks throughout that whole process and, help you with tweaks and help you make any changes to make sure that you have a really good shot at success. So yeah, I want to echo that if you've got a great project, if there's something, that's been floating around in your mind or, in your conversations with your peers that you've really wanted to see done in your community, just reach out, have a conversation and we'll see what we can do to help you out with it and make it solid. Yeah, Of course, yeah.
Sorry, just a quick question, just because we're also Affordable Housing Association of Nova Scotia, so I know I'll get this question as soon as I get back to the office. But to be clear, does HRIF funding cover capital? Because it's under RH directives, so I just want to make sure that I have it clear. So that's a no. Okay, perfect.
Well, it's a no, but so it won't cover a new build. However, if, let's say you have a shelter and you feel that, it would be a really easy project to maybe retrofit 3 units for bridge or permanent housing. If it's something very time specific and can be clearly connected to a reduction outcome. When we think capital, we think multi-year projects with reams of paperwork and oversight. HRIF has to be done in 12 months, each project. So it's got to be something that is complete and shows reduction in those 12 months. So that's why we say no to capital.
Oh, I was thinking even purchase of property, purchasing.
Yeah.
No.
No, that wouldn't work.
No. Yeah, I knew the question would come up in my office.
Yeah.
So.
Yeah, it's more for operational funding with some gray zones, but they're really light gray zones. We wouldn't be able to fund buying a property because how are you going to get people housed in that piece of property in 12 months, right? So, but we can look at some minor renovations, or we can look at painting the unit, furnishings. We can help with some of those pieces, but we can't build a whole building because that's just not what the funds are for. We've been told to exclude capital.
Okay.
Yeah.
So we have a program that goes in to support people who have accessibility needs, who want to age in place, so they can stay in their homes and they don't, flow out into homelessness. We don't. We work with contractors. We wouldn't be asking for funds to do the renovations, but could we ask for funds to support the operations? Would that qualify?
Yeah, that could be a project. I'll give you an example. St. John's and Homelessness St. John's, they partnered with a community partner that works specifically with persons with disabilities. And what they found is that they had a high percentage of people with disabilities in their B&D who were homeless. And it was because the housing wasn't suiting their needs. So they applied, and their project does cover disability aids and minor things. So for example, if they need a small lift, or they need, lights because they're deaf, those types of home-related items, anything that would improve housing retention rates. Yeah. So their project, their aim is reducing returns from housed. And they found that a lot of people who had disabilities, they were moving them into places. Once they got in, they realized these places aren't suitable for me. It doesn't meet my health needs. And they were losing their housing. So yeah, talk to End Homelessness St. John's.
Yeah. And that's the gray zone I was talking about. And going back to what Alex said, if you submitted a project and there were some pieces that, we needed to flesh out because it doesn't really fit in the reaching home requirements for the purpose of HRIF, but there's ways we could make it fit. If we could, we would do that with you. Yeah.
We're always looking for the yes.
Yeah.
We've got about 10 minutes. Any last questions? Yeah. Yeah.
Are all the projects then have to be putting keys in hands and not keeping keys in hands?
It can be both, because keeping keys in hands is stopping inflow. Yeah.
It's yours now. It's a gift. It's a souvenir. No, I'm kidding. The tech guy's right there. Any last questions? It is the last session of the day. I'm happy to give you 10 minutes back. Thank you so much for being here. Looking forward to seeing you all tomorrow for the last day of the conference this year. And again, any questions, you can go right there. I will go back to this slide in case you need contact info for fantastic James or Josh. And that is it. Thank you all so much.